Today we're digging in with one of my favorite things, which is manipulation. It is one of the big distinguishing factors of a chiropractor from other professions. It is the keynote thing that most people know chiropractors for. Chiropractor is made up of a variety of things where we can talk about nutrition, lifestyle changes, exercise, patient education, pain education, and we have 12 different specialties within our field. But the thing that we kind of get most known for is the adjustment. And one of the things that I like to get through is dispel some of the myths that come around this. The chiropractic adjustment most seen on social medias and things like that drive me nuts. They're sometimes way too aggressive on people that don't need adjusting, or on segments that don't need it at all. So there is a variety of how these things can be, and there's different philosophies, and that can be debated amongst our profession. But one of the things I want to give is like the muscle and movement therapy approach on why we do things and how we do them. One, to kind of take some of the scariness that can become from some of these videos online, but also to make some confidence more of what we're doing, so it can kind of fit into your whole health approach. The joint manipulation, or also AKA the adjustment, can happen in different grades. Not everybody has to get the full-on crack, pop, snap one. We can do a variety of mobilizations or graded manipulations. Grade 1 is a very gentle one where we go all the way to where we do a high velocity move where you feel like more of that pop or crack. Thanks, Bob. Thanks for letting me use your elbow. And the key that we're trying to get with the goal that we're getting with these manipulations is decreasing pain, increasing range of motion, and normalizing tissue tone. So if you have a spastic muscle or a muscle that's stuck under contraction, if we can get the joint to move a little bit more through a quick reflex, that allows the muscle tone to come down. If we have a place in the lower back where it's been the big global muscles, where the big sausage erector spinals have been on and contracted for so long, the deeper muscles haven't really been able to contract. When we go through an adjustment, the deeper muscles, the multifidi, they actually are able to kick on, and the erector spinae muscles turn down. This is where so many people have relief right after an adjustment, like, oh, it feels so much better, and then they can move around better because we're actually getting to use the more stabilizing muscles rather than just the big global muscles that are just keeping us upright. And they're protective. And once we get that protection down, we teach the body that it can be a little safer, then those big global muscles and those erector spinae start to settle down, and we get normalized other movements. And that's why the exercise proponent comes in. We add in exercises that go right into the flow of our adjusting. So often I'll find people that are stuck in flexion. When we adjust them, we'll adjust them into extension to try to get them more upright. And then we give them exercises to keep that moving. That muscle memory wants to kick back in, so we want to help fight that muscle memory. So we give people exercises that go right along hand in hand with the adjustment.